What truly determines whether we are healthy or unhealthy? Is it our genetics? Is it the health-related choices we choose to make throughout our lifetime? I'd like to answer this question by telling you the story of Brian Sinclair. Mr. Sinclair died on September 21st, 2008 of inflammation of the peritoneal lining of the inner abdominal wall as a result of a urinary tract infection. But just 2 days before this, Mr. Sinclair was admitted into the emergency department of the Winnipeg Health Sciences Center with issues with his catheter and abdominal pain. Mr. Sinclair remained in the waiting room for 34 hours while vomiting and in very obvious distress. Mr. Sinclair was not seen by medical staff during this 34-hour time period until another patient in the waiting room noticed that he wasn't breathing, and by this time it was too late. Mr. Sinclair was ignored in the hospital because he was Indigenous. Healthcare practitioners assumed that he was drunk and thought that he was just sleeping it off instead of helping him. So truly, Mr. Sinclair didn't die of an infection. He died of racism in the healthcare system in Canada. So our race, our socioeconomic status, our gender, our education levels, these all determine our health outcomes. They are called the social determinants of health, and they are the root causes of illness and death within our society today. The Ontario Medical Association actually estimates that the social determinants of health are responsible for dictating 85% of our health outcomes, with our genetics only accounting for 15%. Now, if I were to ask you who is responsible for keeping us as a society healthy, what would your response be? Had this been pre-pandemic, I'm sure many more of you would have answered that the healthcare sector is solely responsible for keeping us healthy. But now I'm hopeful that many more of you would also answer that public health also shares this responsibility. But right now, when many people think of health, they think of health care. So what is the difference between health care and public health? Public health aims to address the social determinants of health through targeted programs, policies, and interventions. It aims to work upstream to address the root causes of health issues in order to prevent disease and to keep populations healthy. Our healthcare system, on the other hand, where our biggest investments lie, is situated in an individualistic, reactive, and disease-focused model of care. It responds to illness after it has already occurred. There's a common analogy that's used in the field of public health to explain the dichotomous relationship between public health and healthcare. Imagine you're standing by a river and suddenly you see kids in the water calling for help and struggling to swim. You rush in and pull them out, saving them from drowning. This is healthcare. But after you've dried yourself off and are ready to head home, you hear more kids in the water calling for help, and so you rush in again. This cycle continues until suddenly you realize that the river is flowing downstream. So instead of waiting for the next kid to call for help, you run upstream to stop the kids from jumping in the water without a life jacket in the first place. This is public health. So the functions of both public health and healthcare are essential in our society. But due to the way that our healthcare system is situated reactively instead of proactively, it is not positioned to address the social determinants of health. This responsibility has largely fallen on our public health system. And despite the large bodies of evidence supporting the need to address these underlying social conditions, the social determinants of health still remain largely unaddressed today. This has been proven by the major shock to our health system that is COVID-19, which has disproportionately affected our most marginalized groups, including Black, Indigenous, and people of color, those of low socioeconomic status, and the homeless, and has highlighted the inequities that still underpin our society today. So how do we address the social determinants of health, the root causes of health issues, in order to prevent illness before it occurs? I believe that our public health and healthcare systems are working too siloed. What if we could work together across systems to address the social determinants of health in an integrated, whole system approach? What if we could integrate essential public health functions like addressing the social determinants of health and preventing disease into the healthcare system? I believe our healthcare system is actually uniquely positioned to address the social determinants of health in a way that our public health system can't, specifically at the primary healthcare level. Let me give you an example of what this might look like. Imagine you went to your family doctor seeking help for some mental health challenges that you've been having. What if, instead of your doctor prescribing you an antidepressant, she prescribed you a group therapy class, or a music therapy class, or even a weekly art gallery visit? This approach is called social prescribing, and it has gained traction in the UK and spread to other parts of the world, including Australia, Singapore, and has recently been piloted in 11 Ontario community health centers in a project led by the Alliance for Healthier Communities in Toronto. In this approach, healthcare providers are enabled to give social prescriptions to address the root causes of health issues facing their patient, as a complement to traditional biomedicine. So for example, an older adult who has recently been diagnosed with depression due to the social isolation that they've experienced after the passing of their spouse could be prescribed a group cooking class, a weekly art gallery visit, or even a volunteer role at their local community center. In the UK, social prescribing volunteers help patients to navigate not only the health system, but also the social system by connecting them with things such as employment, housing, and even food bank vouchers for those struggling with food insecurity. So we see that an illness really isn't the whole story. It's simply a symptom of these broader social and structural determinants that predispose certain groups to adverse health outcomes. And enabling healthcare practitioners to address these determinants is an important step in improving population health. Social prescribing has been found to decrease hospital admissions, reduce one's risk of developing depression, and increase a patient's confidence and sense of belonging. Let me give you another example of how the social determinants of health could be addressed in healthcare. What if, before you went to your family doctor, you filled out a form that asked you about your personal life experiences, your values, beliefs, and preferences for your healthcare? This way, when you met with your doctor, they already had a picture of who you are, what matters to you, and most importantly, can provide you with the care that you both need and deserve. A picture that they wouldn't have been able to get in their standard 10-minute appointment time slot with you. By recognizing the social conditions that influence your health behaviors and your subsequent health outcomes, they will better be able to provide you with a care experience that is guided by you, the patient. I believe this is the true definition of patient-centered care, a term that's often thrown around in healthcare, and it is the guiding principle of the McMaster Department of Family Medicine's Health Tapestry program. In this program, trained volunteers go out into the community and meet with older adults, who then fill out a report similar to the one I described, outlining their goals, values, and preferences for their health care. This report is then shared with the patient's healthcare team, who use it to guide their delivery of care. This report can also be used to flag patients who are at an increased risk of developing certain health conditions as a result of their current health and social situation. So we see that these upstream approaches are being piloted in Canada, but I believe they need to be standardized and built into our healthcare system as an essential component. Because when we rethink the way we think about health, that health is more than just healthcare, we approach the way we address health and illness differently. By recognizing that health is more than just our genes, we expand the possibilities of how we could and should be responding to illness outside of the standard disease model of care. So I offer this talk to you, the audience, as a challenge to dare to rethink the way we think about health as more than just healthcare, to reflect on the social determinants of health that may be at play in our own lives, and to advocate for the care that we both want and deserve. Because in doing so, I believe the opportunities to restructure our health system to one that is more proactive, person-centered, equitable, and serving to those most in need truly is possible. To me, this understanding of the social determinants of health as a concept is pivotal not only for those in the health sector, but for everyone. When we understand the social determinants of health, it changes the way that we look at the world. Because we can't talk about the social determinants without talking about inequity, which is the unfair and avoidable differences in health and social outcomes that disproportionately affect our most underserved groups. And what goes along with inequity is social justice. When we recognize these inequities, how could we possibly stand by and do nothing? How would Mr. Sinclair's story been different had healthcare practitioners viewed him through this lens? I gained my understanding of the social determinants of health through my undergraduate degree in health studies, and further through my master's of public health, which I am currently studying. And so for me, I always assumed that the social determinants of health were common knowledge for everyone. And if you also come from a health background, you may have thought the same thing as well. But it wasn't until the pandemic that I realized that the social determinants of health, health inequity, and the field of public health in general is an extremely lacking component of our educational curriculums. Today's youth are not being taught these fundamental concepts. My journey into public health began by a stroke of luck, where in high school I found a public health job posting, and I remember thinking, a job where you can directly improve the health of populations through things like policy and disease prevention and health promotion, how had I never heard of this before? And this was such a shock to me because in high school I was taught that if I was interested in health and I liked science, then my only options were to become a doctor or a nurse. And during this pandemic, when public health and its chronic underfunding have been thrust into the spotlight, and for the first time, people are starting to ask questions like, what even is public health and what did they do? Who is my local medical officer of health? I realized that now, more than ever, we need to educate our young people on the field of public health and provide resources for those who will be our future leaders in the field. Not only this, but we need to give youth a platform in developing a leadership role in addressing public health issues across Canada. This realization led me to found the Public Health Youth Association of Canada, which is a national by youth for youth organization. Our aim is to introduce youth to the field of public health earlier in their academic trajectories and to give youth a voice in addressing and generating solutions to complex health challenges. Now, starting a national youth organization during the pandemic is an incredibly daunting and arguably ambitious task, and when I first started to conceptualize how I could possibly make this vision a reality, I had a lot of self-doubt. But after interviewing over 95 youth from across Canada during our first member recruitment, where we asked them the simple question, what is one health issue that you're passionate about? Their answers reinforced that everything that we were doing and working towards was worth it. Because I was reminded that youth are the future. We have solutions to complex health and social challenges, and we need a seat at the table with decision makers at every level of government in Canada. So my message for youth is this: dare to make your voices be heard. I think many youth today, myself included, think that our voices don't matter and that we don't have anything substantial to contribute to important conversations. But if there is something that you are passionate about and you have an idea or a solution about how to address it, then you need to take that step. Apply for youth funding opportunities and grants. Email your MPs and decision makers. Start that YouTube channel you've always dreamed about and apply for a job that's out of your comfort zone. You may think that your action won't matter, but we need to act locally in order to generate change globally. Our voices are more powerful than you think, and from my experience, you will be supported by other youth just like yourself every step of the way. What started as an idea for the Public Health Youth Association of Canada has now grown into a national initiative, as we've received federal funding and had over 70 youth from across Canada join us in our first member recruitment. These youth are working on policy briefs, delivering presentations in high schools across Canada, and educating youth on the social determinants of health and health equity. Most importantly, they are advocating for a world that they want to grow up in and a world they want their children to grow up in. Today's youth truly are the next generation of global change makers, and we have the power to demand change and to provide solutions for pressing health issues that we are seeing today, if we dare to let our voices be heard.